Tess, thank you for your time. Really appreciate you giving up your time. For those who don't know, can you just introduce yourself and give us your background, please?
Yes. So first of all, Seb, thank you. Thank you for your time and the time of your listeners, readers. My name is Tess Player. I am the global head of what we call expert, but essentially it's healthcare professional and health influencers here at GSK, soon to be Haleon. I have actually been with the organisation for about 26 years across a number of different geographies, across a number of different brands, but primarily looking at everyday health, consumer health from a marketing point of view. And that's really been a passion point of mine since I was quite young. I worked as a pharmacy assistant during my university holidays. I did pharmacology as part of my degree, and health in particular, and making sure that we can give the opportunities for more people to get better access to better health has always just been a bit of a passion point for me.
Okay. And Tess, you very briefly mentioned Haleon there. So GSK has just recently announced Haleon as a new brand. Can you tell me what this new brand is, where it's come from, and what it encompasses?
Yes, so we're really excited. So GSK, as many of you will know, is made up of different divisions, if you like, within GSK. There's a pharmaceutical vaccine, soon to be called the new GSK, which will be focused on biosciences, and the consumer healthcare division, which will soon to be separated and rebranded as Haleon. And Haleon comes from the mixture of two words. So Hale, as in the Old English word of hale and hearty, sort of health, and Leon, which is the Greek for strength. So health and strength, which is what we're all about and going to be all about. And with that, we have a sort of newly stated purpose, which is about delivering better everyday health with humanity. And we have a brand that we're in the process of creating, a new corporate brand, which in the way that it looks and feels will be hopefully very different, modern, vibrant, but importantly in the way that we want to show up our brand character, about being really sort of restless to address some of the health issues we all face today, but also with a sense of being really straightforward and straight talking, so that we can really mobilize every person into getting better everyday health.
Okay. So what does the Haleon brand specifically, what does it now incorporate?
All right, so the organisation will essentially be what is currently the consumer healthcare part of GSK. So it will be, we're in 120 plus markets around the world. Our portfolio of brands and categories fall into three primary categories, which is therapeutic oral health, which is the brands that you know, Sensodyne, Parodontax, Corsadil, and the Denture Care brands, so Polident, Poligrip, and in some markets in the world, Kariga. The pain relief category, so again, we know that there's a lot of recommendation and prescriptions given for Panadol around the world, Advil, less so for Voltaren, but that's a topical pain reliever brand. And then we have our respiratory business, Otrivin and Theraflu, and therapeutic skincare brands. And then finally, our wellness portfolio, which is primarily Centrum, but also in some markets around the world, brands like Caltrate in China, which is focused on bone density. So that's the portfolio. So that's the market span, the portfolio span. And then for us, what Haleon will all be about is delivering better everyday health with humanity. And for us, the with humanity piece is really important. It's what differentiates us. So it's about making everyday health more achievable, more sustainable, and more inclusive.
Okay. And what was it, Tess, that made GSK or made you decide to separate these two brands out?
So I think there's essentially the opportunity to focus on everyday health. So being part of a pharma company brings with it great sort of discipline around the science we create and the proof points for the products that we make, and the way in which they work for people. But with us separating out, we get a chance to really focus just on those everyday health needs. So prevention, stopping people from getting ill in the first place. In the case of obviously dentistry, making sure that people brush their teeth twice a day for 2 minutes, and therefore the partnership that we have with between us and our consumers, and how we talk to them and how we create those brands, but also between us and our healthcare professionals, so that we partner to help with the prevention and maintenance in the area of everyday health. So as a separate company, we're able to have that real focus.
Okay, and you mentioned they're partnering with healthcare professionals, specifically dentists and dental professionals. What impact? How will they see a difference? How will it impact them?
All right. So the first thing, we want to make sure that that isn't just rhetoric. Okay, so one of the things that we want to, and we're really determined to do, and me and my role is really determined to do, is make sure that we're genuinely partnering. So that's making sure that we listen, not just at a policy level, or when we partner with the FDI, so the International Federation for Dentists or Dentist Professionals, but that we also make sure that we really listen to what's going on the ground at a grassroots dentist level around the world. And so making sure that we listen at every level to really understand what are some of the barriers that the profession is having in helping their patients take better care of their teeth, their mouths, etc. And around the world, we see four sort of consistent barriers, and they're around making sure that patients understand what it takes to have better oral hygiene. Think teenagers brushing their teeth is a perennial issue. Then there's the second area around the administrative burden of being a professional nowadays. It comes with so much, doesn't it? And that pressure on the individual when what they're really trying to do is deliver better patient care. Of course, there's the recognition of the profession, and particularly for dentists and dental professionals, around the mouth being the gateway to overall health and systemic health, and the recognition of the profession to make sure that they're seen as an integrated part of that multidisciplinary team that keeps people well. And finally, what I would say is our bread and butter to help and support, but that barrier around, have I got what I need in terms of knowledge to stay at the forefront of my profession so that I can continue to give the best care, advice, etc. to patients. So those are the kind of four areas where we as Haleon think that we will partner with professionals and make sure that that partnership is all about listening and all about action and not rhetoric.
Okay, so it's kind of in the name, but where do you see the future of Haleon going over the next few years?
So we talked about delivering better everyday health with humanity, and I think the areas of making everyday health more achievable, more sustainable, and more inclusive give a sense of direction for the organisation. So let me just pick on one of those in particular. So for the more inclusive, when we think about the access that people have around the world to the professionals they need to get the advice and the direction from a healthcare professional, it isn't always there. People don't always have what they need to in terms of literacy or understanding about what behaviours they need to change in order to stay healthy. And so one of the things we're doing is partnering with The Economist to work on an index, so think gender pay gap or the Edelman Trust Barometer, to create a health inclusivity index that will look at what are the core determinants of health and health equality in particular, and what are some of the things that are getting in the way of people being able to access better overall health. So that's at an overall health level. We're also then partnering with The Economist to do a specific deep dive around oral health in particular. And that will give us as you say, the future of where are the areas we need to focus on. One of them in particular that will come out of the index, we've seen some of the early findings already, is health literacy. So people understanding what appropriate brushing technique is, how do we get that education into teenagers, schools, institutions, and using our strength as a marketing organisation to enable that better communication in order to help better health literacy. So that's just one example, I think, of where our organisation will go in the future.
Okay, it sounds like an exciting time ahead, Tess. That's all the questions I've got. Is there anything else that you wanted to just highlight from your perspective?
Well, so I'd love to, if I can, just say, so whilst we're becoming a newly branded organisation, those are the things that will change. Some of the things that will just stay the same is the Sensodyne will still be made in the same factory. Your rep that walks through the door will still be the same rep. The way in which we conduct our clinical studies to prove the efficacy of our brands and the science behind them, all of those standards and quality standards will stay the same. So there'll be a lot that's changing, but there's a lot that's really everybody can be reassured that will continue just in the way that we have done to date.
Perfect. Tess, thank you so much for your time, giving us your time. And yeah, it sounds like an exciting couple of months ahead. We look forward to it.
Yeah, so brilliant. Thanks for your time. And obviously, when we come to things like the work we're doing with The Economist and other initiatives, we'd love to come back and just talk to you about how they're going.
Perfect.